today we're going to be talking about the social determinants of health. For most of you, you probably already know this, but for the sake of those who don't, we're going to be discussing this and this in the context of tuberculosis. So does everyone know what tuberculosis is?
Yes.
Okay. So basically what we want to accomplish today, first of all, the two frameworks, we don't want you to memorize that. That's not the point of today, okay? We want you to embrace a broader paradigm or way of thinking or frame of mind. That's the main takeaway today. And then after knowing everything, the biggest question is, where can you step in? Okay? We also want you to be able to embrace the social determinants of health of our community specifically to translate your knowledge into actionable interventions that improve their health outcomes. So, what's tuberculosis? Anyone know? Yeah?
It's a respiratory disease that's very infectious.
Yeah, okay, so it's an opportunistic bacterial do we have Pochi? Do we have candy?
So you're gonna stop.
He's the one with the candy, dude. You give me Pochi. Oh, sorry. So, it's an opportunistic bacterial infection caused by this bacterium. It's not really as important as knowing that it's opportunistic, okay? So, how is it transmitted? Yeah, okay. It's like my best class because people are actually talking. It's transmitted through the air via bodily fluid particles. So that can be saliva, phlegm, sputum. Just imagine like miniature droplets of those in the air when they cough. These are the biological factors there in the framework. And then fortunately or unfortunately, what happens if you get TB? So not everyone who gets the germ actually gets sick. About 5 to 10% of those who have the germ inside them get sick. So that means there's two types. There's active TB and latent TB. So in active, you're actually sick. Like you have the symptoms, the whole deal, right? For latent TB, the germ is inside you. Like it's just in you, it's waiting to strike, it's dormant. You're not sick, no symptoms, no nothing. If you don't take a test, you probably don't know you have it. So does anyone know how TB is treated? Yes, medicine. But that's a good question, right? Because first of all, again, 5 to 10% of those who have it actually get sick. But treatment is free in all our health centers. And it's daily using the TB DOTS program of DOH. That's direct observed treatment short term. That means that you have to take the pill daily and it's so important to take it daily because if you miss a few doses, then your treatment fails and your case escalates to the worst kind of TB. Okay? So what they do to ensure that they take it daily is every day they have to skip work, skip school, whatever, show up at the health center and literally stand in front of the health worker to take the pill in front of them. So that sounds hassle, and it is. We'll learn a bit later what other implications that has. That's because some people forget. Other people sell the medicines when they're given it because they're so poor they have other things to pay for. So that's really sad to think about, but they prioritize the health or the welfare, the education of their children rather than their own health. So that's something to think about. Okay, so how do you actually get sick of it if not everyone gets sick of TB? Does anyone know? So about 20 to 30% of our population has latent TB. So think about that. That's like 20 to 30 million people with the germ inside them. Of course, not all of those people are sick, as we said a while ago. This is the figure from the Western Pacific region of WHO. The Philippines is part of that. So basically, all of you have been exposed to TB. In fact, if I did a skin test, on your skin would be TB. That doesn't mean it's inside you. Only 20 to 30% actually get it inside them. And of those people, only 5 to 10% get sick. So, the question is, why aren't we all sick of TB, right? Everyone hears about measles now, dengue. What's the other outbreak? Polio. No one's talking about TB. Why is that? Why is no one sick? Does anyone know? So again, not everyone gets sick. And you're thinking, that's a pretty unlucky 5 to 10%, right? I don't want to be that 5 to 10%, but the fact is none of you are that 5 to 10%. Because it's not exactly random. There are things that determine whether or not you actually get sick. So chances are, all of you here, even though some of you may have the bacteria, all of you will probably never get sick. That's because you're rich and comfortable. And I really mean that, and later you'll know what that means. What does that mean when you're rich and comfortable? Because even if you're like super stressed in college or you're a scholar and you're barely making it, you're still better off than the rest of the country. By a lot. So think about that. But what's the connection, obviously, between money and getting sick of TB? So you get sick of TB when you're in a bad place in life. So that could mean stressors, that's the psychosocial aspect of the framework. That could be nutrition, working conditions, how it is in school or at home, that's your material circumstances. It could be because of vices, tobacco and alcohol, behavioral. Or it could be HIV, that's biological. TB is one of the leading killers of people with HIV because it weakens your immune system. What are you doing?
Are you guys still awake? Yes.
So let's go to the first one, stressors, right? Everyone knows what stress is. I mean, you're in college. If you don't know what stress is, I don't know what you're doing. But this is the psychosocial aspect of the framework. So think about this. Think about toxic relationships, cruel bosses, terrible freeloading group mates. I'm sure you know what this is, right? Stressful, polluted commutes. Think about low income and everything that entails. Cheap junk food, bad nutrition, no access to clean water, sanitary conditions, bad hygiene. Everything that low income entails. Or what about thinking about long work hours, 2 or 3 double jobs, no sleep? You get the idea. If your life is stressful, you're in a bad place, you're more likely to get TB. Now, I know you guys are stressed, but you're still like so far away from getting TB, so don't worry about that. It's mostly this one, living conditions, which all of you are pretty decently well off. Does anyone know any other conditions besides what I said that can lead to TB?
Presence of autoimmune diseases.
Yeah, we'll get to that later. But like, stuff you don't get to choose, like where you're born into. What do you think you guys are born into that you don't get to choose? Type of family?
Genes.
Yes, we'll go to that later. No, but like in the world, outside your body. But yeah, so basically everything in your life, quality of life. Sorry, what? Yeah, social status. That's a big part of it. That's this entire column. Socioeconomic position. So let's go to vices. So it turns out, contrary to popular belief, that the poor aren't just walwal. You know, they're not just uneducated, they're not ill-mannered. The poor and other people in pretty bad places, otherwise known as the marginalized, if you've heard of that term, they're disproportionately more likely to have vices. So think about it this way. You guys are so stressed and so you go out drinking. You need an escape. Them too. Except it's not just school that's stressing them out. It's finding food for the table, defending against criminals, running away from tokhang. All these things. And this is their escape. You can't blame them because the statistics show it. It's not random. It's not that someone is born, you know, so walwal and they start doing this stuff. I mean, for your social class, it's probably more of smoking. So now that you know, it's not really related to income because actually in Europe, the richest are the ones who smoke. In other places, it's the poorest. So it really depends in your culture. What other vices make you TB prone? Do you guys know? There's a lot of vices. Wink. Yeah, drugs. That's a big factor. Gambling. What's bad about gambling?
You lose money.
Okay, and then?
If you lose money.
How long do you stay in the casino?
I don't go to the casino.
Not you! Okay, what's common between gamblers and people who play video games all night? They stay up all night. That counts. Even if everything else is okay but you're not sleeping, that counts. So let's go to HIV. Again, HIV, human immunodeficiency virus, it's usually coupled with AIDS. That's when it's symptomatic already. AIDS means autoimmune deficiency syndrome. It means your body's killing itself. It sees itself as a foreign entity and it's fighting it. So it means its immune system is basically non-functional, and when you have a weakened immune system, as we said, that's when you get TB. Remember, opportunistic infection strikes when you're in the worst possible place. there's a bunch of other biological factors like not sleeping, genetics, as she said. If you develop leukemia, lupus, all these other immunodeficiency syndrome kinds of diseases, that makes you more prone to TB too. So the main takeaway here is that it's not just like healthcare. It's not just because you came into contact with the germ. There's so many non-health things that decide whether or not you get sick. Does anyone know what I'm getting at in terms of that entire framework? So yeah, unlike most people who get latent TB, it's pretty big, 20 to 30 million. Unlike most of them, there are those who get sick because of it. That's the differential health outcomes aspect. So what we've been talking about are these four. So this is kind of our flow today. Differential contexts, where you are. Differential exposures, what you're exposed to because of where you are in your life. Vulnerabilities, how you can cope with those, and different outcomes, whether or not you actually get sick. So in general, when people are worse off, they're exposed to different and usually more amounts of risk. Does everyone know what risk is? Pretty basic, dangerous stuff that's bad for your health. Some people are exposed to more of those than others. In our context, it's health damaging situations. So they're more exposed to unhealthier things. So think about like, is your neighborhood safe? Is it poor? Is it rich? Is there lots of crime? Is it full of dirty, unhygienic conditions? Are there lots of stagnant pools of water, especially now that there's a dengue outbreak? Or how are the establishments near you? Can you buy fresh food? Or is it all fast food? Is it all 7-Eleven? Is the fresh food affordable? Are there fresh markets, wet markets? Are there any gyms or sports venues? And if there are they affordable? You know, not everyone can afford Anytime Fitness in UP Town. Or think about your commute to work. Is it filled with pollution? Do you ride in your own enclosed car? Do you ride in a non-enclosed car? Jeepneys, buses. Grab counts as enclosed. Is it full of bars or casinos, as she mentioned? So what do you guys think are common in poorer areas that are not so common in richer areas? Or the converse, what's in your area that's not so much in the poor?
Bad sanitation.
Yeah, said that. Thanks. Anyone? Yeah?
Clean water supply.
Clean water supply. Not so common. You know, there's a hospital in Antipolo City Hospital, that doesn't have water. They get tanks every day delivered by the fire department. So just think about that. A hospital with no clean water. That's the Philippine government. Anyway, anyone else? What's common in poorer areas? Rats, yes. Rats are vectors of disease, yeah?
Was about to say gangs.
Yeah, crime. It's a big thing. Tokhang. Do you have Tokhang happening in Dasmariñas Village? No. Is it happening in Tondo? Yeah. Furthermore, so we just talked about exposures, right? What the poor are exposed to without their choosing. What's around them. Now we'll talk about vulnerabilities. So, to these risks that we just talked about, some people are more vulnerable than others. Does everyone understand the concept of vulnerable? Like, they're more prone to it. They're more likely to actually get something bad out of it. Think about it this way, like, how do you manage despite where you are in your life? How prepared are you when catastrophe strikes? Like, for all of you guys, when it's bagyo, you're always thinking about suspension. You know, you don't think about, do I put sandbags behind my doors? Do I put boards beside my windows to stop my house from falling down? We don't really think about these things, but other people do, and it affects them. So, though the entire Philippines is exposed to storms, some people are worse off in dealing with it than you guys. Or think about stress. Like we said a while ago, stressed people are more likely to engage in vices. So even though every convenience store sells cigarettes, and hence the same exposure, some people are more vulnerable to actually getting addicted than others. Or think about one major hospitalization. Like, how far are you away from the poverty line? Because for a lot of people, one hospitalization, like think they got knocked unconscious and some good Samaritan brought them to the hospital. They would actually not like that because they can't afford it. And that entire hospitalization would put them under the poverty line. Remember fighting poverty through health? That's why. Because they can't afford it. And so Project LAAN fights to stop them from getting sick in the first place. I have this thought experiment that a good professor of mine gave. It's about social capital. So think about this. Everything you have, every physical item besides the clothes on your body, your bank account, all your money, if everything burned, how bad would your life get? Like, how likely are you guys to actually end up as beggars on the street? Like, if everything disappeared, every physical thing you own, like realistically, how low can you go? You guys get the picture? But chances are, all of you guys have relatives who are probably as well off as you, or friends who are probably as well off as you. They're willing to adopt you, clothe you, feed you. For a lot of people, they don't have that. Everyone they know, even though they're generous, it's not a question of generosity. Everyone they know is as poor as them. Everyone they know can't feed their children too. So how are they going to help you? Right? That's social capital. It's capital because it's a resource, but it's social because it's not physical. Well, it's physical, they're people, but you get the idea, right? It's not something that you just account every day in your spreadsheets. It's the people you know. Or let's make it worse, like everything disappeared and also everyone you knew disappeared. Chances are, all of you guys would still not end up as beggars on the street. That's because you've all finished high school. And that's, like 7 levels higher than the national average? The national average, people finish grade school, like grade 5. That's the national average. Somewhere around there, depends on the region. Right? So the fact that you finished high school, in most businesses will already land you a job. So forget the fact that you lost everything. At least you have income to look forward to in at least 2 weeks. For them, who haven't even finished grade school, or are working so hard to get their children to finish grade school or high school, they don't have that. So social capital can be in 2 ways. The people you know, and what's already being invested in you. Education is an investment. It's not tangible, but it's in you. And you're all better persons because of it. So again, the poor don't have that. So what happens if they get sick? If they lose everything? You guys know how common fires in slums are? It's not usually reported because most people don't care. Or at least the minority of the rich don't care. But it happens pretty often. You could lose everything, especially that you're building with non-structurally sane materials like wood. Catches fire. So as you can see, some people are worse off than you. And they don't really choose to either, right? And I know you guys are here because you passed asset or something, or through your own merit. But you have to acknowledge that where you are in life, it's also a lot because of where you were born into. Stuff you didn't decide. Stuff that didn't depend on how good you were. That's called privilege. Privilege is starting ahead of the race, in front of everyone else. So really, what does being worse off means in our context? Initially, you guys think, it's just the unlucky people who get sick of TV. But being worse off is all these things. Everything we've discussed and stuff we haven't discussed, they all factor in. So, why are people worse off? Let's talk about the framework now. So, their place in society, otherwise known as their socioeconomic position, SEP, it's decided, affected, or defined by their social and political circumstances. So the circumstances of the society around them, their government, their country, everything around them that they don't choose. Those are circumstances. That's their context, right? These things over here, that's their context. Think about, is there a war in the area? How functional is the government? Is the economy good? But if it's good, is it good for everyone? Or is it worse off for those who can't pay the train law's tax? Is it suffocating like the train law? Are there good social policies like social health insurance that actually works? Mostly unlike PhilHealth in other countries. Has anyone heard of the UK, their National Health Service? So in the UK, basically every health service they have is free. The government pays for it. In fact, if you go to the hospital and you can prove to them that you had a really long and expensive commute, they will even pay you for your commute. Like, think about that. You're getting healthcare and you're not even paying, but they're paying you to get help. Why do you guys think the government pays for people's health? It's because the UK government has taken it upon themselves to pay for treatment and to reimburse any inconvenience because they've decided it's their fault that the country makes it hard to be healthy. That the country they have, the society they have, is not conducive to being healthy. The government thinks it's their fault. Because think about it. Tokhang is the government's fault. Poverty is mostly the government's fault. These people aren't lazy. They just don't have the opportunities or the resources. But again, the important thing here is that it's the government that takes it as their fault for failing to maintain a society where being healthy is easy for everyone. Think about how the labor market is. Is it easy or difficult to get a job? How good or accessible is the education, even if it's free? Is your society biased to hiring college graduates? I mean, that's why most of you are here, right? Or at least the kind of work you want to get, you don't think will be possible without a college degree. Isn't it weird that to be a cashier in McDonald's, they prefer if you have a college degree? Like, it's just basic math, but they think you need a college degree for that. And that's already a minimum wage job. Or is college only accessible through suffocatingly high student loans? Think about land in the country. Are farmers properly paid, not paid at all, harshly paid? What about their hacienderos? Are they fair? Or do you live in a sexist or racist country? Or have detrimental cultural and societal values? Actually, that's one of the biggest factors for HIV, why HIV is transmitted. And the subpopulation of HIV that is like in the thousands and thousands % of increased rates is MSM, males having sex with males. Because it's stigmatized to do what they do. Because they don't use condoms because they think pregnancy is not a risk. All these things. And because for HIV it's really important that partners get tested very often, and people don't want to do that because it's so stigmatized. If they're seen in the clinic, the parents are going to freak out or something like that. It's stupid. Sometimes you even need the consent to be, I think, 18 or 21 to get the test, which is ridiculous. Because most of the people getting sick are younger than that. So that's how your values affect who's getting sick. Is it highly patriarchal? In China and India, if you're born a girl, there's a good chance your parents are going to kill you. Because they want males. Because males are so, quote-unquote, productive. Is it homophobic? Or back in the Nazi times, were you a Jew? You know, these things you don't decide. Your contexts. So let's go over everything that being worse off entails. So these contexts, everything I just mentioned, these might deliberately put you in a bad place. You might be born a black slave in post-colonial America. You might be born a girl in India or China. Or you might just be born in the Philippines to a poorer family. Stuff you don't choose. Contexts. These contexts, these might indirectly affect you by exposing you to worse conditions. Because like we talked about a while ago, poor people have worse off things near them. So even though they didn't choose to be poor, they're exposed to that and you aren't. That's a differential exposures aspect. We've also mentioned vulnerabilities, or how well you're able to cope with the risks. So it doesn't matter if the risk is already there, but how well can you cope? Think about this for vulnerabilities. You know how land is so cheap in poorer areas? Like outside Manila, Fairview, stuff like that. But there's lots of crime because it's further away from, the Ayala places or Makati. But if you're rich, you want big land, you buy lots there and you build tall walls. So even though everyone is exposed to the risk of crime, you're not vulnerable to it because you have tall walls and bulletproof cars. The person across the street from you has a wooden door that can be kicked down by Tokhang cops, right? So that's vulnerability. Same risk, but some people are worse off than others still because they can't cope with it. And because of all these, you experience worse off health outcomes. So whether or not you actually get sick of TB is hugely dependent on how vulnerable you are to it, how you can cope with it, It's not so much the exposure, because like I said, most of us have been exposed to TB in one way or another. It's just we live so healthy that it doesn't get the chance to strike. Even for health outcomes, like, imagine you're already part of the minority of the population that's already sick, or you're in the poor and majority are sick, or something like that. Whether or not you can actually deal with that is also dependent on your material circumstances. Can you afford treatment? I mean, it's free, yeah, but can you afford to skip school or work? Because, you know, unlike school, unlike work, you don't have cuts, right? If you cut a week, and treatment for TB is like 2 to 6 months. Can you imagine skipping work for 2 to 6 months? I mean, even Ateneo, with their lenient cuts, it's only 3 weeks of cuts. So, you know, that matters in their treatment. So again, this is the framework. We already had it there, but this is like what it really looks like if you want. This is the social capital we were talking about, the people you can rely on. These are the structural determinants and the intermediary determinants. This is where you are in society, where that puts you, what you're exposed to, also this, and how you can cope with it. So, if you guys joined this org because of healthcare, that's us. This tiny thing, that's healthcare. Okay, that's how little a role healthcare plays in people actually getting sick. Because healthcare is for people who are already sick. But it shouldn't be that way, as we'll discuss later. So talking about the structural determinants, again, like I was talking about, these are the contexts. It affects where you end up in society, your socioeconomic position. How conducive or non-conducive is the society around you in maintaining or not maintaining good health? For the intermediary determinants, these decide whether or not you get sick, regardless of your context. This is kind of like what you're exposed to and how you can cope with it. So these are the different exposures and vulnerabilities that stem from the contexts, different risks, different abilities to cope. These mediate how bad the sickness will actually affect you if and when you get it. Right? So it's not just that they're exposed to the sickness, like if you guys are exposed, you probably have. It's also how likely they are to get sick. Most of you will never get sick, of TB at least. And how easy or hard it will be to coping with if you get sick with TB. For most of you, you probably won't even go to the health center even if it's free, because you can't afford to show up every day and take the pill in front of someone. If you go to a private physician, you'll pay for the meds, but they'll trust that you take it every day. Some of them will FaceTime you every day to watch you swallow it, but at least you don't have to show up, right? That's a big part of it. So these are the ways that people get sick. Morbidity means getting sick. Mortality means dying from it, right? So these are the different pathways we've discussed to getting sick, and how your context, exposures, vulnerabilities affect that. So let's wrap up SDH, right? So the main point of SDH is that there's health inequities. As you guys can see from here, structural determinants of the social determinants of health inequities versus here it just says health. This is what makes people unequal, inequities. Like some people are worse off exposed to it, right? Like we said with exposures. And these ones decide whether or not it actually affects your health. So that's why it's determinants of health. So again, inequities, that's the main focus of it. That's what it's trying to point out, because some people have it worse off than others. And most of the time, that's the poor. The poor are unfairly, disproportionately more burdened, troubled, and affected by disease. Now we'll go to the framework to cover the other half, the intermediary parts. So the framework's over here. So yeah, coping with TB. Think about if you're already sick with TB. We're gonna tackle that part. Does anyone know what a health system is? So yeah, this is the framework, right? So a health system is made up of all the organizations, people, and actions that have the main goal of preventing, promoting, restoring, and maintaining health, right? Preventing sickness is a big part of it. So they have two goals. Well, not really goals, but like two actions that they can do. One is to address those things, the determinants. Or they can have the more obvious things, the direct health improving activities, aka treatment, medicines, preventions. Even preventions still count as some sort of intervention. But interventions are different from the addressing things like income and inequality. So there's 3 levels of interventions: primary, secondary, tertiary. In primary, the main goal is to prevent getting sick in the first place. So, let's keep you healthy and not sick. Secondary is to minimize the impact of disease. So you're already sick, but let's minimize the impacts it has on you. Let's minimize the bad effects it has on you. Like for TB, screening is important because that's before you have all the other comorbid infections that happen with TB. For HIV, detection is good. For cancer, getting detected stage 1 is so much better than stage 4, right? That's secondary. Screening tests, that kind of stuff. And tertiary, that's obviously healthcare. Getting treated, antibiotics, surgery, that kind of stuff. But we don't want people to get to this already because it's so much more expensive. This is cheap. This is population-based stuff. Can even be individual-based stuff. But it's a whole lot cheaper than an operation. A screening test is like, what, 1,000 pesos compared to at least 100 grand for surgery? So, can anyone tell me what kinds of primary interventions we have besides vaccines? It's everyone's favorite buzzword now. Yeah, primary. Think, guys. It's more than just vaccines.
Vitamin C.
What? Yeah, vitamin C. What else? I have like one pochi. Food.
Diet.
What about food?
No, proper diet.
Proper diet. Eating properly. What else? Primary. I'm sorry. Sorry. Can you pass? Thanks. Yeah. So, things that, what about informing people about the screening tests we talked about a while ago? That's a primary prevention. Or what about telling people that TB is no longer contagious after 2 weeks of treatment? That's primary. Or, for the people who don't have the TB at least, because they know not to be scared or stressed about it. What else? Knowing about the symptoms of dengue, so you can go to the hospital early. Know how to prevent dengue by all the modules are teaching people to not leave stagnant water laying around. Those are all primary preventions. Stuff you wouldn't usually link to health. Giving people better jobs is technically a primary prevention, but more macroeconomic. More determinant side than directly health improving. Interventions are directly health improving. What about secondary? Besides tests, what do you guys know? Secondary is hard. I won't ask for tertiary because everyone knows what surgery is. So you're sick with TB. Let's go through like what someone sick with TB goes through, right? So you go to the health center, you deal with the health worker. That's the health workforce. This thing. That's the health workforce building block. So just an overview. These are the building blocks of health, the health system. These are what they want to achieve, the 4 goals. And these are the 4 things they need to accomplish to achieve said goals. So these are like intermediary things, or just like things you need to achieve basically to get those goals. And then you're treated with TB dots. TB dots, that's service delivery. That's the treatment aspect of it. That's one building block. But, TB dots only exists because the country knows that TB is a big problem. And now that sounds sarcastic, but you wouldn't know TB is a big problem if you didn't have the health information system, information research, to actually report which barangays have it, how many cases, who has it specifically, which demographics of people have it, the smokers, the non-smokers, the rich, the poor. Data is important to identifying what the problem of the country or community is. And that's one building block, right? For the next 3, so government, obviously, leadership in government, they decide what the health system prioritizes, what they make policies for, which policies they actually implement or fund. Because after a law is passed, it's not exactly guaranteed that it's going to get money for it either. There's so many laws that exist that are just not funded, or that are not, like, imagine funding not just buying the stuff for it, but like paying the people to actually implement it. In government offices, you're not allowed to give them gifts, no matter what you do. Like, even if you're so thankful, but no one checks that. So that law is useless because it's not implemented. There's no money to implement it. So the treatment you're getting, natural medicines, that's medical products, vaccines, and technologies. That's one building block as well. The government usually pays for all this. That's the financing building block. But in our case, the TB DOTS program specifically, it's paid a lot by multinationals. So that's UN, WHO, UNICEF, that kind of stuff. Because we're too poor to afford that, sadly. So again, let's go to the goals. Obviously, it's to improve health. But not just to improve health inequities. The people who really need the help, not the people who can afford treatment. That's who we need to help. Health inequities, those who have it worse off than others. Next, they should also be responsive. Now, you may have never heard of this term before, but basically it means you treat your patients with dignity and respect. That means you include them when you're making solutions. Like, think about this. Ateneans are so prone to developing solutions for the world, and then they're just like, the world's gonna be such a good place if we just implement this. But you didn't ask the person who actually had the problem. But you need to do that. You need to ask the people who are actually having the problem to ensure that your solution will actually work in their context. So that means actually seeking representatives, going there, not just being open to their opinions, but seeking their opinions. It also means empowering them to seek healthcare in the first place, to take better care of themselves, after you've made them more aware of how to take better care of themselves. The next goal is financial risk protection. Basically, people who need treatment should get treatment whether or not they can afford it. Nobody should have to think, oh, I need help, but can I afford it? No one should have to forego treatment, meaning not get treatment, because they can't afford to do it. Either because it's financially expensive, or because it's opportunity cost expensive, like with TB. You can't afford to give up your job to go every day and get treatment. Lastly, no one should be impoverished or put under the poverty line because they sought help. Healthcare is help. Whichever level, it's help, right? They need the help, and why would you make them pay for needing help? Lastly, efficiency. So you have to do all those things while not breaking the bank, not ending up in so much debt for your country. You have to make do with what you have and make the most out of it. Basically the point of that. But to achieve these, we need to pass through this arrow, which is these four things: access, coverage, quality, and safety. First is access. So those that need the intervention, they need to be able to access it. What does that mean? They can reach it. Physically reach it. Is it on the second floor of a building and you're disabled and there's no elevator? They can financially reach it. Can they afford the commute? Can they afford it with their time? Can they reach it that way? Every single way people don't reach something is a lack of access. They also need to ensure coverage. That not only do they give these treatments for TB, but you have treatments for all other health illnesses. So that's coverage. It's not just nationwide or something. It's for all other health problems. So think about this. There's TB DOT centers mostly nationwide, but are there dialysis centers nationwide? Are they all in Metro Manila? Are there vaccination centers nationwide? So these things, these are other major concerns for a low middle income country like ours. So that's what it means to have coverage. Next is quality. So these treatments have to actually be effective in improving health outcomes. So for example, they have vaccines, they're nationwide, and they have people to administer them. There's a health center there. But while they were transporting it, it's no longer cold. So an important thing for vaccines is they have to be maintained at the cold temperature, because vaccines are usually live, meaning there's bacteria there that's alive, or it's a virus that if it's exposed to heat, it's gonna denature or break down. Basically, the vaccine doesn't work anymore if you didn't store it in an ice pack the entire way. And think about what that entails. From manufacturing, to selling, to transporting, to the health center, to unpacking and loading in injections, everything, until the moment it's injected in you, has to be cold. So if any one of those fails, the vaccine doesn't work anymore. It's ineffective, and that's bad quality. Lastly is safety. So, has anyone heard of Dingvaxia? I'm sure you guys have heard of Dingvaxia. Dingvaxia is actually a pretty good vaccine. I read the papers. It was just used incorrectly. So if you guys aren't aware, if you give someone Dingvaxia and they haven't had dengue, they're gonna get life-threatening dengue the first time they get it. It's gonna be really bad. But if you've had dengue and you had Dingvaxia, the next time you get dengue is gonna be you're not even gonna go to the hospital. You're probably not even gonna go back to a doctor. It's just gonna be like a cold. Not a cold, but like a slight fever. Something like that. It works. But how do you determine whether or not someone has dengue? And think about this. It's not just because they don't remember that they had dengue. You know, there's 4 levels of dengue, and there's like the 0th level, which is like dengue fever. It's before even stage 1. Most people who have a fever don't go to the hospital just because they think it's any other fever. Yung pala it was dengue. Yung pala they qualified for dengue vaccine, but they didn't know. And how's the government supposed to know if even the person doesn't know, right? Or stage 1 to 4 dengue, that is detectable through medical means. You get their blood, you check the antibodies for dengue. If it's there, then they've had dengue. If it's not, then they haven't. But that's expensive. And the government was rushing this program, so they didn't do it. That's why it's wrong. But now, especially in the dengue outbreak, we should be vaccinating the people who had dengue to prevent more cases. But, you know, there's so much like bad blood around it that we just like dismiss it entirely. But it was a good vaccine. So again, now that we talked about those, let's talk about what gets someone from being sick of TB to dying of TB. Mortality. So, blocking it. But these are the different ways that we'll go over of how people end up dying of TB. So, first scenario. The healthcare worker they have is, I mean, they're already there. That obviously the health center exists, the medicines are there and everything. But the worker is rude and condescending. They call you a piece of shit for showing up late every single day. But they don't know that your commute takes 2 hours. And you have to walk through like half a mountain or something. Okay, sorry. Maybe like a hill. But you get the idea. Like the commute is hard and that's why you're late. Like even if you left at 3 a.m., you still show up at like 9 a.m., which is late compared to their 8 a.m. I don't know. So again, because they're so rude and they call you a piece of crap every time, you stop showing up. And what did you say about TB treatment? It's like 2 to 6 months. If you stop showing up, it all goes away. There's no like partial treatment for TB. In fact, it probably gets worse if you stop. You get drug-resistant TB. So yeah, what part of the health system is failing? Yeah, pwede. But let's focus more on these. This is more tangible kasi. In the first class we said that. You guys are smart. So yeah, it's responsiveness. Because what did we say about responsiveness? Dignity and respect. Not just because we're like, you know, I'm on my high horse and moral ground, whatever. It's because it has real impacts. If people stop getting treatment, even if it's there and free and everything, just because you're rude, then your treatment is failing. And what's our outcome? Better health outcomes. And if you fail that, then you fail. The health system is failing because of responsiveness. So another case of responsiveness is in America, where black women are 3 times more likely to die of childbirth than white women. Just because they're black. It doesn't matter if they're educated, they controlled it for education, income, place of like residence, whether or not they have access to a good hospital, doesn't matter. If they're black, there's a responsiveness failure because there's like judgment and discrimination, and the doctor is more likely to make mistakes because they don't care as much. That's responsiveness, and that has real effects. It's not just because we care about human rights or whatever. Second scenario, the treatment is free, but people are nice. But you have to commute so far, still. And most likely, you'll be fired from your job if you keep cutting because you need to get treatment. Because every day you have to swallow the pill. You can't afford to get it private because it's like 1,000 pesos a week for the meds. What part of the health system is failing? Yeah, financial risk protection, that's one. What else? What? What? Efficiency, not so much. What else?
That includes the arrow, guys.
Access. Diba? They can't access it. Even if it's there, even if it's free, even if the people are nice. There's 2 ways that'll manifest itself. One, you just can't go. Like you can't afford to not feed your child because you have to like give up your job to show up every day. Or think about the other thing. You showed up every day but you lost your job. You're cured of TB, but you're now in poverty. That's weird, it rhymes. So those are both failures. And what did we say about poverty? You're more exposed to things. You're more likely to get sick. So what does it matter if you got cured of TB, if you lost your job because of it? Because now you're more prone to getting sick of something else. Even TB, you can get TB again multiple times. Third scenario, treatment is free, they even pay for your commute, and they give you money if you lose your job. And the people are nice. But when you get there, all the other patients are scared of you. They move away from you, they run away and say you're disgusting. I mean, it's understandable because TB is highly contagious and very severe. They don't want it from you, right? So if you guys don't know, in health centers, they have a TB dots room, and it's usually in the outskirts. It's either outside, like, you know, it's like in the same building, but you can't access it from the inside. Like, you have to go outside through the door to the outside. Or, like, there's literally bars dividing the people who are there for checkup or vaccination. And it makes sense, because for the health system, they don't want the sick getting other people sick. Makes sense, right? But because everyone is so rude and, like, disgusting and everything, you stop going. Or what if your family, I mean, you could be getting it in the health center, but when you get back home, your family locks you up in, like, the shack in the back or something. What part of the health system is failing? Besides responsiveness. Out of all of these, I hear whispers. Raise your hands. Yeah?
Information.
What about that?
Sorry to cut that. Well, the fear is caused by
Stigma.
yeah, stigma, right? And then if your parents lock you up, it's because they don't know how to properly assess it.
True. So like we said a while ago, after 2 weeks pa lang of treatment, even if it's a 6-month-long thing, after 2 weeks you're no longer contagious. But they don't know that. So can you blame them? That's actually the health system's fault. Under what he said, information and research. It's their job to promote TB. The symptoms, when you should seek treatment, usually it's if you cough for 2 straight weeks, they tell you to get checked. What it entails, what TB entails, what are the risks of stopping treatment, why people shouldn't be afraid of you, stuff like that. Even for HIV, this is really important. Did you know that if you make out with someone with HIV, you won't get HIV? Unless you have a sore in your mouth. Because what does the sore mean? The blood, right? Your bloodstream is exposed. But for most people who don't have sores, that's nothing to be worried about. You don't have to, like, get afraid of, I mean, this counts even for the workers, right? Afraid of touching someone with HIV, or you guys, you've never heard of someone having HIV. Information is really important for diseases. So again, for STH, the main problem is not just health outcomes, but health inequities. That some people have it worse off than others, and it's usually the poor. They're unfairly, disproportionately, meaning more burdened, troubled, and affected by disease. For health systems, it's that the health system is designed to promote, improve, and maintain health by any of the 3 interventions we talked about. And this means to everyone, whether or not they're inequitably exposed. So again, it's not part of this, but they want to improve health outcomes and health inequities. So yeah, any questions? We have time for questions. Like, I purposely finished early for questions. Questions? Don't be shy. Yeah?
I feel like this will be a dumb question, but
No, it's fine.
like, essentially, where are healthcare centers located? Like, is it per barangay, per Quezon City?
It's per barangay.
Per barangay.
Some barangays that are big even have more than one. But again, the quality of the health center matters. In Calauas, in our community, their barangay health center is like smaller than this room. One story, smaller than this room. And it's divided into two rooms. One with like the nurse and everything, and then one with like the doctors, you know? And like literally the ceiling is falling. Like it doesn't make sense because we have the LGU, right? The whole country is divided into LGUs and they're all given money. But because the LGU of Antipolo still doesn't prioritize its worse off barangays. So, one thing I might have missed. So you guys might be wondering how this affects our community, right? So in Calauas, for example, one determinant that makes them have worse health outcomes compared to you guys is that from their barangay, just to the main road, like think main road like Katip or something like that, like to Marcos Highway, I think. Just to Marcos Highway is like a 300 peso commute. Not because it's far, but because they're so like secluded and poor that no one goes there. Tricycles don't go there because they're like, I'm not gonna, like, you know how tricycles have to like go from one place to the next and then they're banking on getting a customer there? Well, the tricycles are like, if I go there, no one's gonna hire me, so I have to charge them twice, going in and going out, right? 300 pesos for people as poor as them, that's like a week's income. There's another big problem in Calauas. Tertiary interventions. They think everyone who goes to tertiary interventions dies, which is not because they go to bad hospitals, but precisely because they keep delaying it until it's really, really bad because they can't afford it. They're like, I don't want to go, like, if I'm just having a headache, I'll just deal with it. If I'm just having, like, if I broke my arm and I can make my own cast, then I'm not going to go to the hospital. Okay, that's kind of extreme. But, like, the point is, they really, like, they like, have, like, a spiritual or, like, stigmatized or, what do you call it, stereotypical fear of hospitals because they have this saying that everyone who goes to a hospital dies. But it's not because the hospital's bad. It's because they always wait till the last minute. So what does that mean? For LAAN, that means primary interventions are really important. First of all, stop them from getting sick. Second of all, let them know that even if they do get sick, it's not like a death sentence. If they go early enough, they could be saved. Information is really crucial. LAAN prioritizes primary interventions because they can't afford to get sick. It's so much better if they just don't get sick. That counts interventions, that better feeding, road safety. So we're doing a road safety module tomorrow. I don't know if any of you guys are going to the visit tomorrow, but that's because almost every week someone dies from a motorcycle accident in Calauas because it's so secluded and the roads are so bad. There's no CCTVs. There's no street lights. There's 10-year-olds on motorcycles. Like when I go there, and I've been there a lot, there's like 10-year-olds like speeding and racing each other on motorcycles with no helmets. Or they have a helmet that's on their elbow. Because for some reason they think their brain is in their elbow. No. But that's still information, right? They don't know that it's risky. They don't know that if it's raining, you should drive slower. There's this really morbid thing about government hospitals, specifically the ones along Quezon Ave and stuff. When it's raining, they call it harvest season. What does that mean? Because there's lots of young people who die from motorcycle accidents. Who are usually, it's usually their head that goes kapoosh, right? But we don't need brain transplants, we need transplants of kidneys and livers and lungs and hearts. Harvest season. They don't know that, but unlike cars, motorcycles are way more likely to crash. Sorry, I'm so done. Who has more questions? Pass it down. Oh. We'll be passing around like a tutu bank if you guys wanna. Because one of the ways Calauas gets to the hospitals is they have an ambulance, but it broke, and so we paid to fix it because they couldn't afford it. And now we're broke. So.
You're not supposed to know that.
Joke lang, we're not that broke. But like, if you guys could help, that would be great. No, but hey, questions. If you guys don't have questions, or you're like me and you're just shy, you can ask me through these channels.
Same like you love.
Otherwise, please answer the evals. Your attendance doesn't count if you don't answer the evals.
So it's Reg and
Also, if you're curious about everything I said, the studies, the whatevers, I don't want to bore you, but it's all in the references. The slides, the readings, it's all there.